The biological imperative. The irreducible mechanism of action. The body as a closed system. The first principle underpinning all bodywork, from deep osteopathic manipulation to light effleurage, is the biological imperative. The fact that manual pressure on soft tissue creates predictable and measurable physiological changes. This is the irreducible mechanism of action. If touch did not reliably alter the state of the body, bodywork would merely be theater. The combined knowledge from Muscolino's Kinesiology, Nicholas's Atlas of Osteopathic Techniques, and the various sports massage guides, like Findlay's, forces us to distill the mechanism into two core self-evident truths: the mechanical effect on tissue structure and the neurophysiological effect on pain and sensation. The mechanical effect, structure, fluid and metabolism at its core. A living body is an incredibly sophisticated hydrostatic and metabolic system. Injury, poor posture, and intense exercise, the targets of intervention in sports and clinical texts, lead to predictable physical degradation. Fascial adhesion and fiber disorganization. Muscle fibers, fascia, and connective tissue become bound, shortened, and disorganized. Adhesions. This reduces the tissue's elasticity and ability to slide freely over adjacent structures, directly restricting range of motion, ROM, and increasing strain. Ischemia and congestion, prolonged tension, hypertonicity, or adhesion mechanically compresses the local capillary beds. This leads to ischemia, reduced blood flow, starving the tissue of vital oxygen, O2, and nutrients while simultaneously slowing the removal of metabolic waste, lactic acid, cellular debris. The tissue becomes congested, leading to localized pain and inflammation. The mechanical application of techniques, deep friction, as emphasized in sports injury texts, petrissage, the kneading action described in Swedish and general guides, and myofascial release, a core component of Muscolino's work, acts to mechanically counteract these two problems. Tissue restructuring, thixotropy. Applied force, especially shearing and compressive forces, physically disrupts the crosslinks in fascial adhesions, moving the tissue toward a more fluid, organized state. This mechanical input prompts the tissue to align fibers and restore pliability, directly improving ROM. This is a purely physical action, a form of controlled, localized micro-trauma designed to elicit a healing response. Fluid dynamics, hyperemia, and drainage. The rhythmic compression and decompression inherent in massage techniques acts as a peripheral heart, accelerating the flow of blood into the compressed area, reactive hyperemia, and crucially, accelerating the lymphatic drainage of interstitial fluid and metabolic waste. By flushing the area, bodywork essentially resets the metabolic environment of the tissue, replacing waste products with fresh O2 and nutrients necessary for repair and sustained function. This principle is crucial in post-event recovery. Strategies detailed in the sports texts, the neurophysiological effect, the gait control theory. The second, equally powerful truth is that the immediate sensation of relief is not purely mechanical. It is largely neurological. The various texts on general and targeted bodywork implicitly or explicitly leverage the gait control theory of pain, the self-evident truth that the nervous system cannot process all incoming signals equally. The signal, race, pain is transmitted via small, slow-conducting C fibers, nociception. Touch, pressure, and vibration, the core outputs of any massage technique, are transmitted via large, fast-conducting A-beta fibers, mechanoreception. The spinal gate. Both signals enter the spinal cord's dorsal horn, where an inhibitory interneuron acts as a gate. The faster, stronger, and more consistent input from the massage signal, mechanoreception, arrives first and activates this interneuron, which then effectively blocks or modulates the slower pain signal, nociception, from ascending to the brain. Immediate. Relief. This is the explanation for the instantaneous relief felt when rubbing a bump or pressing a sore spot. It is not that the tissue has magically healed, but that a stronger, non-painful signal has neurologically overridden the painful one. This explains why tapotement, Rapid light percussion in the pre-event phase stimulates the nervous system to increase alertness, arousal, and why even light effleurage in the post-event phase provides immediate soothing. Systemic and psychological. Corollaries beyond the local effects. These truths have systemic corollaries. Systemic circulation. Improved local circulation contributes to better overall systemic return, reducing the load on the heart and improving peripheral function, a vital component of recovery. The relaxation response. The modulation of the nervous system extends beyond the spinal gate. Consistent therapeutic touch shifts the balance from the sympathetic nervous system, SNS, fight or flight, to the parasympathetic nervous system, PNS, rest and digest. The ultimate result is a measurable reduction in heart rate, blood pressure, and cortisol, stress hormone levels. This overarching calming effect is the core goal of the relaxation benefits described in the various general massage guides, e.g. the Complete Guide to Massage. In summary, the biological imperative asserts that bodywork is effective because it is both a mechanical restructurer that aligns fibers and flushes waste, and a neurophysiological modulator that uses non-painful signals to block the perception of pain, ultimately shifting the body into a state conducive to healing and restoration. These mechanisms are the non-negotiable foundations upon which all techniques and applications, from clinical osteopathy to tantric energy work, are built. They are the immutable first principles of the body's response to therapeutic touch. The systematic imperative, contextualizing force and intent, the body as a process. The second principle, drawn particularly from the specialized texts on sports massage, Findlay's work, and the diverse range of techniques, Eastern, Swedish deep tissue, is the systematic imperative. The self-evident truth that the application of force must change based on the context, goal, and timeline of the intervention. It is the recognition that the body is not a static object to be worked on, but a dynamic process to be supported. A failure to match force to phase is invariably a failure of professional practice. The problem of undifferentiated technique. A layperson might assume massage is a monolithic entity, one set of techniques applied universally. The conglomerate of books immediately dispels this notion. The goal of tantric massage, spiritual connection, energy flow, necessitates a radically different touch than the goal of a deep tissue session, adhesion release, pain relief, and both are different from a chair massage, quick relief, stress reduction. The irreducible truth here is, technique is meaningless without intent, and intent is dictated by the client's current phase. The tri-phasic model, the athletic timeline as the ultimate context, the sports massage texts provide the clearest articulation of this systematic principle by dividing the athletic timeline into three distinct, non-negotiable phases, each demanding a wholly unique mechanical input. Pre-event phase, goal, arousal, and preparation. Context. The tissue is cold, the nervous system is focused on performance, and the goal is to enhance power and flexibility without causing sedation or microtrauma. Irreducible technique. Brisk, superficial, and stimulating, e.g., fast effleurage, and stimulating tapodiment. Why it works. First principles. The rapid light input is designed to activate the sympathetic nervous system, SNS, to increase alertness, excite the muscle spindles to prepare them for contraction, and create mechanical hyperemia, warming, without compromising the structural integrity of the tissue, literally preparing the neurophysiological gait and the fluid dynamics for maximal output. Post-event recovery phase, goal, waste removal and soothing. Context. The tissue is metabolically exhausted, inflamed, potentially micro-traumatized, and the nervous system is often hyper-aroused or depleted. Irreducible. Technique. Light, slow, and directional, e.g. focused. Gentle effleurage and light petrissage guided toward central circulation, lymphatic nodes. Why it works. First principles. The light touch, applied after the acute period, is designed to primarily engage the parasympathetic nervous system, PNS, for global soothing and to mechanically assist the lymphatic drainage of metabolic waste and inflammatory byproducts, the flushing action. Deep friction is contraindicated, as further mechanical damage would impede the necessary inflammatory and repair processes. Maintenance, corrective phase, goal, restructuring and prevention. Context. This occurs during the long training cycle, separate from immediate competition. The body needs deep structural work to address chronic restrictions, postural imbalances, and old adhesions that limit ROM irreducible technique. Deep, focused, and slow, e.g., deep tissue, myofascial release, specific friction against the grain, of fibers and trigger point therapy. Why it works. First principles. This phase is where the therapist applies the full force of the mechanical effect, from Principle 1. The intent is to leverage thixotropy, the shift in fascial state, to physically lengthen and reorganize tissue, demanding sustained pressure and precise angles to access deeper layers. This is the cornerstone of the osteopathic and kinesiology texts, where structural integrity is the key to injury prevention. Beyond sport. The context of technique. The systematic imperative extends beyond the athletic field to all forms of bodywork. The Mumford-Liddell texts, Eastern versus Western. These general guides highlight the contextual shift in technique based on philosophy. Western techniques, like Swedish, are primarily somatic and systematic, addressing muscle groups sequentially for physiological benefit. Eastern techniques are often energetic and prescriptive, focusing on acupressure points or meridians for internal balance, demonstrating that the map the therapist uses, meridians versus musculature, changes the application of touch. The therapeutic relationship, the history of massage. Calvert's text on history demonstrates that the role of the therapist has always shifted, from ritualistic healer to medical assistant to modern relaxation specialist. This professional context dictates the permissible and expected force. A medical referral demands clinical precision, deep targeted work, while a spa session demands a holistic, gentler approach. In summary, the systematic imperative is the principle of contextualized force. It is the professional truth that mastery lies not in knowing many techniques, but in knowing when and why to apply a specific mechanical input. It dictates that the therapist must first assess the client's position in their life or training cycle, their process, and then choose the appropriate technique, speed, depth, and duration to achieve a precise, phase-specific physiological or neurological outcome. The holistic imperative, the integration of knowledge, the practitioner as a synthesis. The third foundational principle, drawn from the sheer volume and academic weight of the texts like Nicholas's Atlas of Osteopathic Techniques, Muscolino's Kinesiology, and the specialized guides, is the holistic imperative, the irreducible truth that effective professional bodywork is never just about good hands. It is a skill built upon a profound, layered understanding of the human body, requiring the practitioner to synthesize three distinct, non-negotiable pillars of knowledge. This is the understanding that the practitioner is a synthesis of knowledge, not just a channel of force. Pillar 1, Anatomy and Physiology, the irreducible map. This is the bedrock, the base layer of the pyramid of professional competence. The 800-page kinesiology text and the 672-page osteopathic atlas underscore the absolute necessity of this layer. Self-evident truth: you cannot effectively treat what you cannot identify, A&P as a constraint. Bodywork is fundamentally an act of palpation and differentiation. The therapist must feel through skin, fat, and layers of superficial muscle to precisely locate the target structure, e.g., the origin, belly, or insertion of a specific muscle like the subscapularis or a specific spinal landmark. Without this knowledge, the therapist is merely rubbing the surface, risking damage to sensitive neurovascular bundles, a failure of the biological imperative, or missing the root cause entirely. The language of the body. Anatomy provides the therapist with the language to interpret a client's symptoms. Pain referred down the leg is not just soreness, it is a potential sciatic nerve irritation, requiring a systematic check of the piriformis muscle or the lumbar spine. This is the leap from generic touch to clinical reasoning. Pillar 2. Biomechanics and pathology, the understanding of dysfunction. The middle layer is the dynamic application of the static anatomical map. Biomechanics is the study of how forces act on the body, movement physics. And pathology is the study of how those forces lead to injury or dysfunction. Self-evident truth. You must understand how the body moves and breaks to know how to fix. As the chain reaction. A therapist cannot simply treat the site of pain, the symptom. They must understand the kinetic chain, the fact that dysfunction is often a chain reaction. For example, the sports massage texts teach that a runner's knee pain is often a consequence of weak gluteus medius muscles or excessive pronation at the ankle, causing rotational stress at the knee. Treating the gluteus medius is a biomechanical intervention that resolves pain at the knee, a pathological symptom. Differential diagnosis, osteopathy. The Atlas of Osteopathic Techniques highlights the most rigorous application of this principle, the ability to differentiate between a muscular issue, treatable with soft tissue work, and a joint capsule restriction, tendinopathy, or neurological compression, which may require specific joint mobilization, referral, or contraindication. This ability to rule out and rule in conditions is what separates the professional therapist from the lay practitioner. Pillar 3. Hands-on techniques and soft skills. The application. The peak of the pyramid represents the actual application of force, but it also includes the essential, often overlooked soft skills that translate knowledge into effective practice. Technique as a tool. As established in the Irreducible toolkit, friction, effleurage, etc., techniques are the tools. But knowing when to shift from deep pétrissage to localized friction, and why, is determined by the knowledge in Pillars 1 and 2. Technique becomes a prescriptive action based on assessment, not a random application of force. Soft skills, the human element. The general guides, such as those by Susan Mumford, Complete Massage Course, inherently rely on this principle. Communication, eliciting feedback, pain level, comfort, ensures the application of force is therapeutically effective and respects the client's nervous system. Draping, touch, boundary setting, crucial for trust and safety, especially in contexts like tantric massage or any form of deep bodywork where the client is vulnerable. Timing. The systematic imperative demands precise timing. The therapist must know when a technique has achieved its biological effect and when to move on. The holistic imperative concludes that expertise is the seamless integration of these three pillars. The professional bodyworker is not simply someone who knows how to rub, but someone who understands what they are rubbing, anatomy, why it is dysfunctional, biomechanics pathology, and how to apply the appropriate stimulus, technique, soft skills, to create a measured, predictable, and therapeutic biological response. Without this holistic synthesis, the practice collapses into an uneducated, high-risk application of random force. The methodological imperative. The distillation of techniques, the Irreducible toolkit, the fourth foundational truth, synthesized from the sheer variety of methods presented, from Swedish and chair massage to Eastern and deep tissue, is the methodological imperative, the realization that the hundreds of named techniques are merely variations of a few core mechanical inputs. Regardless of the name, philosophy, or cultural origin, every form of manual soft tissue therapy uses the same irreducible toolkit of 4 basic actions to interface with the biological imperative. The illusion of variety, the titles alone suggest. Overwhelming complexity, Swedish, Eastern, Tantric, myofascial release, trigger point therapy. The methodological imperative argues that these names are primarily philosophical, intent, or systematic application distinctions, but they all revert to the same 4 mechanical interactions with the tissue. The essential truth is, there are only 4 ways to mechanically treat soft tissue, the 4 core mechanical inputs. Every technique, when stripped down to its physics, is a specialized application of one of the following inputs. These are the tools that directly enact the mechanical effect and neurophysiological effect. Principle 1. Shear glide, effleurage. Action. The application of a broad, gliding pressure across the tissue surface where the therapist's hand or forearm remains in continuous contact. It is fundamentally a shearing force parallel to the surface. Biological goal, primarily neurophysiological, soothing, warming, setting boundaries, and fluid dynamic, pushing venous lymphatic fluid toward the heart, the core of the post-event flush. Philosophical role. Essential in almost all forms, Swedish relaxation, Eastern, as the opening and closing movement, demonstrating its self-evident role in regulating the systemic process and the relaxation response. Compression, kneading, petrissage. Action. Rhythmic, deep squeezing, lifting, and rolling of a large muscle mass like the calf or thigh. The hand separates the tissue from the bone. It is fundamentally a combination of compression and decompression. Biological goal, primarily fluid dynamic and mechanical restructuring. The squeezing action acts as a localized pump, maximizing hyperemia, blood flow in, and lymphatic drainage, waste flow out. It begins the process of releasing generalized adhesions by physically mobilizing the muscle mass. Philosophical role. The defining stroke of Swedish massage and a major component of maintenance corrective work in sports, demonstrating its critical role in deep metabolic resetting, specific targeted pressure, friction, trigger point. Action. The application of sustained, non-gliding, deep force to a small, localized area, often perpendicular to the muscle fibers. The skin moves with the finger. It is a highly focused compressive and shearing force. Biological goal, primarily mechanical restructuring. This is the key input for releasing specific deep adhesions and inactivating trigger points, hyperirritable spots. The sustained pressure creates a localized therapeutic ischemic event, followed by a rush of blood, hyperemia, upon release, physically stretching and mobilizing a specific restricted fascial layer. Philosophical role. The cornerstone of deep tissue, myofascial release, and osteopathic soft tissue technique, highlighting its clinical purpose in addressing specific pathologies. Principle 2. Percussion sound vibration, tepodiment. Action. Rapid, rhythmic, and intermittent striking of the tissue surface using the hands, cupped, hacking, beating. It is a rapid series of low-amplitude mechanical shocks or vibrations. Biological goal, primarily, neurophysiological and fluid dynamic. The rapid input is highly stimulating, activating the nervous system for the pre-event phase. When applied over large muscle masses, it also helps shake loose phlegm and stimulates local circulation. Philosophical role. A common element in invigorating. Forms of Western massage and a defining element of the pre-event sequence in sports, demonstrating its purpose as an arousal mechanism. The synthesis of method. The methodological imperative reveals that the apparent complexity of the field is manageable because all techniques are merely creative combinations and modulations of these four inputs, determined by the goal, systematic imperative, and guided by the map, holistic imperative. Myofascial release is a slow, sustained application of specific pressure and shear. Chair massage is a quick, functional sequence relying heavily on compression, kneading, and specific pressure applied through clothing. Tantric massage, while primarily focused on the neurophysiological and energetic effects, still utilizes highly controlled shear and light compression to engage the client's sensory system. By accepting the methodological imperative, the aspiring practitioner moves from passively learning a list of named techniques to actively understanding the physics and biology of their four core tools. This first principle allows for professional creativity and integration, as a technique learned from an Eastern text can be seamlessly applied to a sports massage context if the mechanical input matches the required biological outcome. The hands, ultimately, only have four fundamental languages regardless of what the mouth calls them. The energetic and emotional imperative, the interface of mind and body, the body as a story. The fifth foundational principle is derived from the non-clinical texts that address the family relationship, body, mind, spirit, and tantric applications of touch. This is the energetic and emotional imperative, the irreducible truth that human touch is not just a physiological input, but a profound psychological and emotional interface. All texts, even the clinical ones, must implicitly or explicitly deal with the fact that the body is a storage vessel for personal history and emotion. It is the body as a story. Touch as the first language, the book of massage, tantric massage. The most general guides emphasize the non-verbal emotional power of touch, which is a self-evident truth about the human condition. The neurochemistry of safety. The therapeutic encounter immediately releases oxytocin, the bonding trust, hormone, and serotonin, a mood stabilizer, and reduces cortisol, the stress hormone. This is the underlying neurochemical basis for the feeling of relaxation, noted in virtually every text. This mechanism is powerful enough to be a primary therapeutic goal in non-clinical settings. The therapeutic container. The act of receiving. Sustained non-sexual, non-judgmental, focused touch creates a safe container for the release of stored tension. This tension is often deeply tied to emotional or psychological stress. This principle is vital in understanding the market for general relaxation and well-being, as described in texts like The Complete Guide to Massage. Stored emotion and the somatic link. The clinical text, while focused on pathology, cannot ignore the link between emotion and muscular tone. This is the crucial intersection of the energetic and emotional imperative with the biological imperative, chronic hypertonicity, the physical manifestation of stress. Postural muscles, trapezius, scalenes, psoas, often maintain a state of chronic hypertonicity, excessive tension, directly in response to psychological stress, anxiety, or trauma. This is the body's constant state of preparedness for the fight or flight response, SNS activation. Touch as trauma release. Deep, sustained work, the specific pressure and compression inputs, can sometimes access and release this stored tension. The sudden physical release can be accompanied by a sudden emotional or memory release. The professional mandate, therefore, is not just to be a mechanic, but to be a compassionate witness, a soft skill required by the holistic imperative. Principle. The energetic dimension, Eastern and Tantric philosophy. The Eastern and Tantric texts introduce a further layer of complexity by using a different philosophical map for the same physical reality. Chi, prana, energy flow. These philosophies posit that physical pain and dysfunction are symptoms of blocked energy flow, chi or prana, through energetic pathways, meridians or chakras. Irreducible synthesis. While Western science, kinesiology, focuses on the physical, adhesion and ischemia, Eastern philosophy focuses on the energetic blockage. The irreducible truth is that both systems are often describing the same phenomenon using different vocabularies. The application of pressure to an acupressure point is, mechanically, the same as applying trigger point therapy. It is a focused application of specific pressure to an irritable, high-density neurological fascial locus. The outcome is the simultaneous physiological release, hyperemia, and neurological modulation, gate control. The energetic imperative simply provides the philosophical framework for the intent. The energetic and emotional imperative forces the practitioner to acknowledge that the therapeutic session is a two-way street of human connection. Effective bodywork. Requires the therapist to treat not just the anatomical structure but the whole person, their stress load, emotional history, and sense of self. This explains why the soft skills of presence, intention, and nonverbal communication are as critical to success as the technique itself. A technically flawless intervention delivered without presence or empathy will often fail the greater goal of whole-person restoration. The professional and economic imperative, value, integration, and longevity. The body as a business. The final foundational principle, derived from the sheer commercial existence of this conglomerate of texts, prices, editions, sales volume, and target markets like exam prep, is the professional and economic imperative. The self-evident truth that bodywork is a service that must provide demonstrable value to the client and be structured for the longevity of the practitioner. It is the recognition that the effective practice of bodywork is ultimately a successful business model, built on risk mitigation and performance maximization. The value equation: risk versus return. The specialized texts, particularly the sports massage guides, define the economic and professional value proposition in objective terms: irreducible value. Bodywork's ultimate value is mitigating the risk of failure while maximizing the potential for output. The cost of failure: injury risk. An athlete or a worker with chronic pain who sustains an injury costs the system, team, business, personal finance, money, time, and loss of output. The maintenance time corrective work, Principle 2, is an insurance policy. By resolving minor adhesions, improving ROM, and rebalancing the kinetic chain, Principles 1 and 3, the therapist is dramatically reducing the probability of a major, costly, and time-consuming pathological event, e.g. a hamstring tear or chronic strain. The return on investment, performance longevity. By optimizing the tissue structure and fluid dynamics, Principle 1, the bodywork allows the client to train harder, recover faster, and maintain peak performance for a longer duration. Longevity. In an athletic context, a small, ongoing investment in bodywork yields a massive return in competitive output. In a general context, it yields better quality of life and less reliance on more expensive interventions, drugs, surgery, later on. This is the core economic justification for the service. Professional integration and differentiation, the existence of texts covering osteopathy, kinesiology, and various specialized techniques highlights the professional need for integration and differentiation within the healthcare landscape. Integration with allied health. The most advanced practices, osteopathy, sports massage, are not standalone treatments but are integrated into a larger care model: physiotherapy, chiropractic, medical referral. The professional imperative demands that the therapist understand their scope of practice, know when to work, and crucially, know when to refer, a direct application of the biomechanics and pathology knowledge, Principle 3. Specialization as an economic edge. The existence of niche guides, tantric massage, chair massage, proves that specialization creates an economic advantage. The therapist who masters the systematic imperative for a specific market, e.g., corporate chair massage, deep tissue for climbers, relaxation for new parents, can command a higher price and secure a steady client base. This professional imperative allows the practitioner to move from being a general commodity to a valued specialist. Longevity of the practitioner. The final, often overlooked economic imperative is the longevity of the therapist. Chair massage, a technique focused on providing functional relief in a short format, is often seen as a necessary tool for the therapist to manage their own energy and physical strain. The professional imperative demands that the practitioner find ways to apply their intense manual labor sustainably, using their own body mechanics, derived from kinesiology and anatomy, efficiently to prevent self-injury and burnout, thereby ensuring the long-term viability of their business. In conclusion, the professional and economic imperative frames bodywork not as a luxury or a fringe activity, but as a measurable component of risk management and human capital investment. Its commercial success relies on the effective and systematic application of the previous 5 principles to deliver tangible, justifiable value to the client, while demanding the highest standards of knowledge and sustainable practice from the professional. The economic truth is that health is wealth, and massage is a critical mechanism for preserving and maximizing that wealth.